Express report, having a digestive disease can greatly impact your life, and solving the problem might be complicated and require the cooperation of several different providers and specialists. Middlesex Health's new Center for Digestive Health makes treatment easier, and here with all the details is Middlesex Health Chief of Gastroenterology, Dr. Nadeem Hussain. Doctor, thank you for making time for us via Zoom.
Hi, Teresa. Thanks for having me. Really
sure. Doctor, this is a brand new facility. Tell me all about it.
So this is a brand new program at Middlesex Health, and we're merging all the different fields together. So besides getting your digestive care, we're able to get you in touch with the specialists that you might need, depending on which condition it is.
Sure. And Doctor, talk to us about some of the illnesses that you do treat.
So for example, if someone is suffering from irritable bowel syndrome with cramping, diarrhea, abdominal cramping, and they may have some anxiety symptoms along with that could be aggravating their symptoms, then we can get them in touch with the therapist who can help them with the underlying anxiety symptoms and possibly help with the irritable bowel syndrome at the same time. There's so many other conditions we treat, and they range from irritable bowel syndrome to pancreatic cancer, and everything in between, including liver disease,
sure, but
inflammatory bowel disease.
The goal here is that all of the providers are in one place, so it should make it a little bit easier for the patient.
Yes. So depending on what the patient needs, there's a colorectal surgeon, there's the surgeon who deals with reflux and regurgitation. There's the physical therapy department, if there's stool incontinence issues, we can work on the pelvic floor muscles and strengthen them, and that can help the problem.
Sure. And something different over at Middlesex is the role of a nurse navigator. Tell me about that.
So we have a nurse navigator with the program. Her name is Stacy, and she is involved from the beginning to the end. So once the patient's hooked in with her, then whether you're seeing the GI physician or the surgeon or the physical therapist or the genetic counselor or the dietitian, she will be following along and just making sure that you have a smooth process throughout and everything's being done in a timely fashion.
That must be such a relief for patients.
Yes, it does make a big difference, because if there is a second condition that needs to be treated, for example, if someone has reflux and regurgitation and the symptoms are especially worsened at nighttime, and they may have undiagnosed sleep apnea, getting the sleep specialist involved and treating sleep apnea could really help the basic reflux and regurgitation, which was the initial complaint. So it's amazing how all these things are linked in with each other.
Right. And also, Doctor, I want to discuss the partnership that you have over at Middlesex with the Mayo Clinic Care Network.
So the Mayo Clinic Care Network is a great arrangement that we've had for a few years now. And Middlesex Health is the first in Connecticut that's a member of the Mayo Clinic Care Network. And what's involved with that is, let's say your physician is treating severe Crohn's disease with scarring and fistulas between the small intestine and elsewhere. And the problem is becoming complicated. And once a plan is made, what we can do is refer the patient to the Mayo Clinic. And what that means is the Mayo Clinic will review all the pathology, the radiology, imaging, and then they'll have their expert who deals with that specific condition come forth with their recommendation. The patient doesn't have to even make a visit up to the Mayo Clinic, and it all happens within a week.
Wow, what a great resource. I mean, for a patient going through this, right?
Yes. So that provider can then tweak their plan of care based on what the Mayo Clinic is recommending.
Absolutely, that makes sense. And lastly, Doctor, why would you recommend a patient who might have a digestive issue contact Middlesex Health and the new program here?
So I think it makes such a big difference that it's all part of the same network. So being able to not only deal with the primary digestive problem, but also to be linked in with all the other people that would be involved, it just makes everything frictionless and makes it easier for the patient.
There you go. Of course.
To get the patients to feel better.
Yeah, and that's the ultimate goal, right?
Yeah, exactly.
All right, and you can learn more over at middlesexhealth.org/digestive health. Dr. Hussain, thank you so much for the information and congratulations on the program.
Thanks for your time, Teresa.
Sure thing.